Number 1 is from Evelyn Tweed.
Thank you, Deputy Presiding Officer. To ask the Scottish Government what steps it is taking to reduce the avoidable harms associated with drugs and alcohol.
Cabinet Secretary.
Presiding Officer, we have a range of activity underway to reduce harms from drugs and alcohol. This includes a national drugs mission specifically to save and improve lives, focused on early intervention and prevention, whilst also improving the quality and access to treatment. And this was set out in the cross-government plan published on 12th of January. Furthermore, our National Alcohol Framework sets out our national prevention aims on alcohol. This includes the evaluation of our world-leading minimum unit pricing policy and our alcohol marketing consultation, currently open to responses. These activities are aimed at reducing consumption and minimising alcohol-related harm.
Evelyn Tweed.
Health inequalities are a feature of alcohol-specific deaths. Deaths attributed to alcohol are 5.6 times as likely in the most deprived areas of Scotland compared to the least deprived areas. What steps is the Scottish Government taking within its powers to tackle the root causes of health inequalities and the disproportionate impact alcohol has?
Minister Angela Constance.
Presiding Officer, Ms Tweed is right to highlight the social gradient of alcohol harms. Ms Todd will of course continue to lead the work on minimum unit pricing and the consultation to restrict alcohol advertising and promotion. This is crucial work to changing Scotland's troubled relationship with alcohol. Much of the work I lead in the Drugs Policy National Mission has a direct bearing on improving the quality and access to alcohol treatment, for example, expansion of residential rehabilitation, supporting families, tackling stigma and trauma. However, to overcome the wider root causes of health inequalities, the Government is, for example, investing £4 billion in social security, including the extension of the Scottish Child Payment to £25 per child per week for eligible families. And this financial year, an additional £3 billion to help households faced with the UK's cost of living crisis, £1 billion of which provides services and support not available anywhere else in the UK.
And brief supplementaries first.
Thank you. SNP and Green Ministers approved a cut of £1 million to the alcohol and drugs budget in November. Yet over 100 families in November last year were grieving the loss of a loved one because of drugs. And my thoughts and condolences are with these families. The SNP have stated it's a national mission to tackle this, but you cannot say it and mean it and then cut funding. Frontline services are key to saving lives. Will the Minister commit to reversing the cuts to the alcohol and drug budget to ensure these services are fully supported to tackle this ongoing crisis?
Minister.
Presiding Officer, the draft 23-24 budget for substance use is £160 million. That is an increase from £146.5 million. That includes investment in health boards, investment in the crossover between addictions and mental health, and crucially for the alcohol and drugs budget, which is proposed at £99 million, an increase from £85.4 million. And while of course people can look at the budget line by line, but the overall budget is increasing, and of course the synergy between the work I do in drugs policy and alcohol is very important. For example, the £100 million over the lifetime of this to be invested in residential rehabilitation and aftercare will benefit as many people with alcohol problems as drug problems.
And briefly, Paul O'Kane.
Presiding Officer, on Monday, Public Health Scotland published its Rapid Action Drugs Alert and Response quarterly report. It confirmed tragically an increase in the number of suspected drug deaths in October and November of 2022, an increase of 20% compared with the same months in the previous year. Every single one of these deaths preventable, each one a tragedy. Can I ask what action the Minister is taking in response to these figures to ensure that we are making significantly faster progress, particularly on the implementation of MAT standards?
As briefly as possible, Minister.
Presiding Officer, part of the national mission was to publish more data, more information more quickly so services could respond on the ground. Public Health Scotland have issued an alert around a new substance called nitazene. Suspected drug deaths over the first 9 months of last year have went down, but the member is correct to say there has been an increase over October, November. It is still too early to say whether there is a direct link between nitazene and suspected drug deaths increase in October. In terms of the information and action that has been undertaken, the alert has been issued to drug and alcohol services, emergency services, healthcare and high-risk settings. It has underlined the ongoing importance of naloxone in terms of effective treatment, along with good harm reduction advice. There is also a warning on counterfeit medication in and around not to take oxycodone tablets unless they are prescribed by a medical person. And there is also the importance of outreach facilities, which is part of the implementation of MART, but Public Health Scotland have been engaging directly with the areas where there have been detections.